Eric Salvatore Amas was a student at Kenyatta University and used to share his room with other students who were his close friends. But as he narrates, one day after coming back from class, he overheard his bosom friends and roommates talking ill against him. They had even planned on leaving him behind as they move out. The information was not easy for the 20-year-old to take in, as he thought he was in good terms with his friends. It triggered a psychological effect on him.
Kwa hivyo nilikuwa mwenyewe, so nikaanza kukuwa na hizo thoughts, nikaanza kusema mbona niko mwenyewe and I had friends, vitu kama hizo. So nika feel very low, nikasema na I'm not that of a bad person na najifikiriaga mimi ni mtu mbaya that is. So nikasema let me try and talk to somebody mwenye anaweza nisikiliza juu like ilikuwa imeshaanza kuwa overwhelming.
He wanted to talk to someone who did not know him to vent out what he termed as betrayal from his close friends. Luckily for Eric, one of his teachers shared a number with him to call for counseling.
Kama uko na problem with financial, obvious mtu atakupatia hiyo pesa, lakini akikupatia hiyo mind akwambie these are the times, these are hard times, kila mtu anaenda through that hard time, enyewe itakwambia kumbe siko mwenyewe, like I'm not suffering alone.
In the advent of the COVID-19 pandemic, many Kenyans have been adversely affected from job losses, domestic violence, as well as depression after contracting the virus. According to Ann Muhinja, a telecounselor at the Red Cross Emergency Operations Center, telecounseling has become more effective in this period as many people share their distress with anonymous persons just a call away.
There is somebody who will tell you, I prefer sitting one-on-one. Somebody else will tell you, I'll prefer telecounseling because maybe I wouldn't like to be seen. I wouldn't like this person to see how I look or something like that. But when it comes to one-on-one, I have to come to you, or me, the counselor, have to go to the client, or maybe the vice versa.
According to Muhinja, phone counseling is the game changer as one is able to reach a wider audience compared to one-on-one interactions where time is spent to travel from one place to the other before services begin.
So wherever you are, whether you have transport, you don't have transport, whether you have money to pay for the service, it doesn't matter. As long as you know there is 11.99 at night, during the day, or maybe wherever you are, you can make that call.
It is at the Emergency Operations Center that all calls come in. They are saved depending on the response needed. For those who need someone to talk to for counseling, the calls are transferred to the Counselling Center, where a telecounselor walks the journey with you. According to two reports compiled from the Kenya Red Cross Society Call Center and the Psychological Support Program PSP, run by Minet Insurance Brokers and ABSA Group, stress and loss of income top psychological issues that COVID-19 patients face. It also emerged that more male than female patients seek counseling.
People are going through so many issues and you just need that person to talk to. And whenever you seek that person to talk to, it doesn't mean that you are weak. It doesn't mean that you have so much. It doesn't mean that maybe you are depressed or anything like that. You just need that person who you can confide in. And we are that person.
Some of the recommendations Eric was given was to change his environment as well as engage in other skills development activities to distract him. He had to loop in his mother, which saw them change houses and move away from an environment that triggered his depression.
Hapo hivyo pia nashukurugu mamangu for that step. Juu alini understand, juu nilimwambia nilipitia counseling, nikaambiwa kitu ya kwanza naweza kufanya ni kukuwa kama friendly na the people around. Juu mimi nilikuwa nadhani siwezi share na mtu kama mamangu, juu unajua kuna vitu zingine huwezi share, lakini the moment nilishare nikaona yenyewe it was not that hard na hakuichukulia ile negatively venye mimi nilikuwa nadhani ataichukulia.
As the COVID-19 pandemic continues to spread rapidly, with every effort being made to ensure flattening of the curve, mental health is slowly but steadily becoming a matter of urgency in addressing wholesome individual health. Dana Rose, K24 for the Health Beat.